Earlier this week, a baby died at the Prince of Wales Hospital after she failed to receive medication due to a drug infusion equipment blunder. Representatives of the hospital admitted to being responsible for the tragedy and issued an apology to the infant's family and the public. Timothy Lee has our top story.
On Wednesday, Prince of Wales Hospital announced an infant was involved in a fatal medical incident 2 days after its birth. Today, representatives of the hospital, including hospital chief executive Dr. Chung-Kin Lai, spoke, saying that human error was involved in the tragedy and offered his apology to the child's parents and the city.
I think right now the most important, is to support the family, support the father and mother. So we have sent our clinical psychologists and our patient relationship officers to closely support the father and mother. We have clearly apologized to the family, the father and mother, saying that we have done wrong. We have done wrong, and then we will shoulder all the necessary responsibility.
The infant involved in the fatal accident was part of a pair of twins and suffered from having an irregular heartbeat and low blood pressure. Her mother, who was pregnant for 27 weeks, gave birth prematurely, with the infant being immediately transferred to the hospital's pediatric intensive care unit. Due to the child's underdeveloped lungs, it required intubation devices in order to breathe. The infant also showed signs of sepsis and needed a drug infusion to maintain function in its organs. Because of that, 2 nurses switched to using a 3-way valve for the infant's infusion device, which will allow the baby to receive more condensed adrenaline. The hospital said the nurses did not open the valve during the switch, and the mistake was only discovered 50 minutes later after an alarm sounded. Despite reopening the valve, the infant's health deteriorated rapidly, and it died on Tuesday afternoon. The hospital noted that it is currently difficult to determine whether the child's cause of death was the fault of the equipment error, but stressed that they are not trying to shed responsibility. Some patients' rights groups have questioned whether the blunder was related to manpower shortage. The chief executive of the Prince of Wales Hospital said it will take full responsibility for the infant's death. It will also continue to communicate with the affected family on compensation. Regarding the infusion device, the hospital said it will review its current protocol on its usage to avoid repeating errors. Timothy Lee, TVB News.